understand this, that the way in which this bill has been designed, it is deficit neutral. It does. It is because of the theories that I began to explain in the beginning about how it works. Before 2014, you might ask, what am I to do if I have a pre-existing condition? There is what we call a transitional high-risk pool that's included in the bill for people who are uninsured right now before 2014 because of pre-existing conditions. Now, the states may decide to set up their own pool until 2014, but if they do not, and we have states that are actually just saying they don't want to be a part of this health care program, their residents will be covered by a pool, high-risk pool set up by the federal government, and individuals will be able to hop right over some governor who wants to leave their people out there with pre-existing conditions and no health care and join the national high-risk pool. As of May 3rd, 30 states have already indicated they want to operate their own transitional high-risk pools for people with pre-existing conditions until 2014. 18 have said they would prefer the federal fallback for the citizens of their states. A very important and too little discussed aspect of this bill is the early retiree reinsurance program. It is a $5 billion early retiree reinsurance program that will be launched as of June 1st, just a few weeks from now, several weeks ahead of July 21st start date required by the law. The administration is implementing this bill ahead of time, not only on time, but this is very important because of the large number of Americans between 55 and 64 who do not qualify for Medicare and are left out there without health care when they are early retirees. This plan will cover not only the retirees but their spouses and dependents as well. The amount of the payment of the plan sponsors 80% of the costs attributable to that claim, provided the amount is between $15,000 and $90,000. The cruelest practice of insurance companies may well have been rescission just when you get sick. They find that you are sick, they say, sorry, we can't cover you. As of September the 23rd, that practice will be completely prohibited, and the insurance companies must follow the new rules as of that date, September 23rd. This is something we will be watching very closely because this was one of the very worst practices. Bad enough to get sick, know you have insurance, then have the insurance companies say, we are rescinding, at their own option, your insurance. You didn't commit fraud, you're just not insured anymore. We're not going to cover you anymore. Small business, the small business part of this bill is a very important part because so many Americans work for small businesses, and they have been the most difficult for very good reason. Small businesses often operate on the edge and on the curb. There are very handsome tax credits to small employers to purchase health insurance for their employees, covering, we think, an estimated 4 million small businesses nationwide. They can take advantage of the tax credit now as I speak immediately. And last month, IRS issued its guidance. Already, many have received postcards indicating how to get access to these tax credits so that employees of small businesses can immediately be covered. Many of us have health insurance, but have seen soaring premiums. And that may have been the average American who wanted to look and see what this bill was going to do for those with health insurance, when you consider that the average American already did have health insurance. You and I know that this bill means most, perhaps, to people of color and to others who in this country disproportionately are without health insurance. But even people with health insurance have been dropping their health insurance left and right even before this recession because the cost was too much, and therefore they decided to take the risk. We had to address the average person who saw premiums. You may have seen the president go after one of the insurance companies in California and push them back so that they are no longer raising their rates. But that's what the average American faced. What the bill has is a section that requires that premiums must be used for medical, the greatest proportion of your premium must be used for your medical care rather than for excessive and often unnecessary administrative costs. The cost of health care in the United States was about 30% administrative costs. Why? Because they could, and they did. So the law requires that large group plans, like for example the plan that the AFT might well have, spend 85% of premium dollars on clinical services and other health care or health quality matters. For those in the small group market, 80% of the premium must be spent on health care itself. You know, I don't understand why that's so much to ask. You're paying a premium for health care. What this will force the insurance companies to do is to become more efficient. They want the government to become more efficient. We want you who are handling the health care dollar to become more efficient. And you can bet your bottom dollar when they find out that they've got to put 80% of that into health care, you're going to see a whole lot of efficiencies you never would have seen without this health care bill. There is something very special for seniors, and I'm very fearful of the demagoguery that's been out there for seniors. And I'm very fearful for what may happen in November. The seniors have been demagogued to death with death panels. They've been told that we're paying for the bill out of their Medicare, rather than, for example, out of the efficiencies of the kind I have just indicated. And let me tell you something. For many of my colleagues, probably for most of us, a third of those who go to the polls in November are going to be seniors. And many of us are very fearful about seniors, what they've been told. They are frequent voters. They have every right to hold the government particularly accountable. They have paid their dues. But I can tell you this much, on neither side of the aisle would anybody mess with seniors. And nobody would mess with anybody's Medicare. Now, there are parts of Medicare, such as the Medicare Advantage plan, that took advantage of the taxpayer that, in fact, are going to be reined in.